We need to be bold, innovative, and creative.
Almost the instant the 18-page plan was unveiled by the Ontario Health Minister, intense scrutiny. Dr. Amit Arya is a doctor at a long-term care facility in Toronto. He's worried for the most vulnerable patients in the province.
We're actually possibly going to be coercing people or pressuring people to move into long-term care facilities that are far away from their families and loved ones.
That point was put to the long-term care minister, who insisted that will not be the case.
No, we are not going to be forcing anybody out of a home. But what this allows us to do is start that conversation with a patient, a resident who is in a hospital in the ALC.
Major healthcare groups in the province issued statements of support for the province's plan, including the Ontario Medical Association, the Registered Nurses Association of Ontario, and the Ontario Hospital Association. Not on the list, Canada's largest nurses' union, who says the plan is a blatant move towards privatization.
We don't have enough money to pay the nurses what they should be paid, but heck, we got enough money to, have private clinics, have investors.
For ICU nurse Hala Ayub, a glaring piece missing in the plan: wage increases for nurses and repealing a law that allows the province to cap them.
I love my profession, but I also have a rent to pay. I have other expenses. So that is solution number one.
This is a 2-year postgraduate certificate program.
The plan also includes up to $1,500 for foreign-trained nurses to help pay for fees and exam costs.
I'm waiting so long.
Razan Suleiman is a foreign-trained nurse from Syria and happy for the financial boost, but adds it's not enough.
We need more help. We need things to help us get in the field. We need speed up the process. The process is too complicated.
Amidst the intense scrutiny, some promises from the health minister.
Ontarians will always access healthcare with their OHIP card.
And that the conversation on fixing healthcare doesn't end today.
So, Chris, the province isn't the only one with ideas about how to tackle the healthcare crisis.
Of course, as you know, this is an all-hands-on-deck problem with almost everyone weighing in on the conversation. Today, we heard separate plans from the College of Nurses and the College of Physicians and Surgeons in Ontario, each plan wanting to speed up the process of getting these foreign-trained workers on the job. So for nurses, they want a regulation lifted so these nurses can work in the province while they're getting trained and licensed. And then for doctors, they want a path in place that's already in some provinces that would get these doctors assessed, trained, and licensed in 12 weeks.
Interesting. All right, Chris Reyes, thank you.
Thank you.